And welcome to Farm to Home, our Farm to Home segment this morning. Thomas McDowell, registered pharmacist at Rocky Mount Medical Park Pharmacy, is with us this morning.
All right. Thanks, Sandra. Glad
Good
to be
morning.
here. A little
Were you
chilly.
cold this morning?
Yeah. I had to let my car warm up for a few minutes.
You better
before
believe it.
I
Yes.
got in, but yeah, it was cold today. But
Yes,
glad to be here.
absolutely. So we're going to talk about MacPack today.
Yeah, and I think we've touched a little bit on it in the past, but it's always good to dive into the topic of really medication management is the theme for MacPack. And so, managing medications is not simple.
Right.
And it becomes more complex as we age and as
That's
we
right.
may develop more chronic conditions, and usually what comes with that is more chronic medications. And some stats around it, hospitalizations and readmissions to the hospital are driven in large part by medication issues, medication errors, medication non-adherence, a lack of understanding how to take your medications. And so, if we can get a handle on streamlining that process,
Sure.
simplifying that process is really the key, then we can focus more on our overall health, because the medications can be a huge burden, and if not for the patient, for the caregiver.
Yes.
A lot of times, for mom and dad, their family member might be managing the medications,
Yes.
and they're going over there, filling up their pill box every week, sorting through 10, 15 pill bottles,
Right.
making multiple trips to the pharmacy. Just a huge burden. And
Yeah, and a lot of the kids work, a lot of us work, and it's hard to take that extra time to do that.
exactly. And so, and if your meds aren't really managed and organized well by your pharmacy or your pharmacist, you're probably going to be making multiple trips to the pharmacy each month. That's just how it shakes out. You get put on this medication last month, and then you get put on a new medication middle of the month. Those meds are not going to run out at the same time.
Right, exactly.
So you're coming back multiple times. And so our solution for that problem at Medical Park Pharmacy is the MacPack program. And we've got our MacPack right here. So it's strip pouch packaging, and meds are sorted by date and time.
Okay.
And so we've got our morning meds and the time and the date that you're taking them is on here. And then we've got our evening meds, time and date, and it actually tells you what medications are in each pouch. So each pouch is labeled. So versus sorting through those bottles, you're just tearing off a pouch.
That is so nice to have that. And can you do, if you're a younger person and you don't take that much medicine, but you take vitamins, can you do vitamins?
Yeah, that's
like
a great
that?
question. So absolutely, we have some patients that do it. We have some patients that just do it for convenience.
Yeah.
And
Just
it's
grab
just
one,
easier.
open it, and take it.
Yeah, it's just going to save you time. But we have some patients that just put their supplements. We can make an immune support pack where we put vitamin D, elderberry, zinc, vitamin C, probiotic, and some immune boosting supplements in there. And so there's a lot of customization around that. We can put prescriptions plus supplements, just prescriptions. Whatever you do, the goal is to simplify your medication regimen.
Sure.
And so, we see a lot of patients coming into the pharmacy, or I know our providers, our prescribers see it. They're bringing in, we call it a brown bag, a brown bag full of medications. You kind of dump them out, they're rolling everywhere. There's 50 pills in this bottle, 2 in this bottle, 90 in this bottle. It's really complicated when
Yes.
you really look into it, and you take them all differently. Some are as needed, some are twice a day, once a day, 3 times a day. And some interact with each other. And if you're going to different pharmacies, the pharmacist is not going to be able to check those interactions against the drugs at a different
Right.
pharmacy, because they can't see that you're taking them. So we really encourage using one pharmacy. And if you're struggling to manage your medications or just want to simplify the process, talk to us about MacPack. So it's free. The adherence packaging is free. The delivery is free. We deliver throughout Nash County, Edgecombe County, Halifax County. We go into Martin County and even Wilson.
Wow.
And so
really?
a pretty big delivery
I
radius.
did not know that.
We have about 500 plus patients in the program.
Really?
And so it's once people try it, they love it. It's just a life changer. And often, if the caregiver's managing the meds, they're the happiest of anybody because they can get back a lot of their time. We kind of say, if you're tired of pill sorting Sunday, this is the solution for you, because you're not going in there doing that. We're doing it for you. We're doing it for a month at a time. We're doing all the work, and you're just getting your medications delivered to your door or picked up at the pharmacy, and all of that's handled for you. Our pharmacist and our team of technicians are doing everything. They're coordinating the refills with your provider, getting those ahead of time. They're flagging drug interactions. They're looking for opportunities to save money. If we see that you're on an expensive brand that might have a generic alternative, we're going to bring that up to you. So it's a really hands-on process, but it frees the patient up from doing all these things themselves.
Right.
And it's really something that not many folks are doing. So if you're having trouble with your medications, talk to us about it. Talk to your provider about it. Most of the providers in the area know that we're doing this. And so it's a great program, and really we're focused.
Sounds like it.
We're focused heavily on patients that are homebound too.
Right. And you know, seniors either sometimes or anybody can forget to take your medicine, or you get it mixed up. Maybe, you know, sometimes you might it's kind of scary that you might take the same medicine twice.
Yeah.
That would be scary. Or you don't take them at all. So this would alleviate a lot of that.
Yeah, and the problem, you know, people will tell me, well, you know, I take them from pill bottles. Well, no, I don't have a problem. I take them every day. And, you know, and we might see on our software system that, well, you got a 30-day supply and it's been 42 days. So, you know, you couldn't have taken it every day. So you've missed some doses, but you don't know that you miss a dose from the bottle unless you're literally back counting every pill in the bottle. So this allows you, you know, in the morning, if you have a busy morning, something comes up, and then you know, you normally take your meds at 8 a.m., then all of a sudden it's 10 a.m., and you're thinking, did I take my meds?
Exactly. I've heard my mother say that before. I don't know if I took my medicine this morning
and
or
you're
not.
so scared to double up, you might just not take them at all, which is potentially just as dangerous, especially if you're on blood pressure pills, blood thinners, that sort of thing. And so if you look at your MacPack pouch, it's going to tell you the date, so you know if it's you know, the 17th, and you've got your 8 a.m. January 17th meds still here.
Yeah,
you didn't take them.
You didn't take them.
Exactly. So that's the beauty of it, and the pill box gives you that too, but the pill box is just a lot of work, and there's nothing coordinated for you. You might be able to fill up your whole 7-day pill box with 8 out of 10 meds, but you don't have enough of the other 2.
Right.
And that's just inconvenient and leads to an error or missing a dose. So we're really, you know, trying to let folks know in the area that are homebound or limited mobility about this program, because they can really benefit from it. And we call that piece MacPack at Home. It's kind of an extra layer of service, more accessibility to our pharmacy team. It's almost like getting the benefits of long-term care pharmacy services as if you were in a you know, a rest home type situation while you're still in your actual home.
Right.
So that oversight, that medication regimen review, the coordination, the free delivery to your home, the syncing of the meds, the coordinating with your providers. So that's MacPack at Home. So we've kind of ramped it up to not just be a convenience thing. This is a really high level of pharmacy service. And we always talk about, you know, pick your pharmacy and your pharmacist like you pick your doctor. You need a relationship with them, because I can tell you, if you're, you know, using maybe mail order pharmacy or something like that, you know, those are like assembly lines. You know, they're cranking things out, and you're just not getting that thorough oversight that you're going to get with a local independent pharmacy. And that's just the way it is and the way it's set up. We're better staff. We're going to spend more time with you. We're going to get to know you. So once people try it, they love it. You know, so it's a great program, and we're looking to grow it. So if you have questions about it, call us at Medical Park Pharmacy. You can reach us at 252-443-7979. And if you're in the surrounding areas outside of Rocky Mount, you're closer to Scotland Neck, we can serve you from there as well. We own McDowell's Pharmacy in Scotland Neck, so we can serve, you know, about five or so counties, you know.
That is a really good service.
So
I mean, it really is.
we're excited, and the adherence data is great. You know, when we're talking about adherence, we mean how well you adhere to your medication regimen. So that means we want you to be at 100%, or even if you're over 100%, it means you're picking up your pills, your medications a couple days early each month, which is fine, which is great. But if your adherence is below 100, that means you're going days without having meds.
Right.
So you're skipping meds, or missing them, or forgetting them. The data for this program, we're pushing towards 99% adherence.
Wow.
And especially if you're in the MacPack at Home program, where we deliver it directly to your door, the adherence is all over 100%. And the prescribers love to see that, because
Yes.
when the patient's coming back into the pharmacy, into the doctor's office, excuse me, the prescriber's going to say, all right, are you taking your meds?
Yeah, your labs are out of control. What are
Yeah.
you doing? Well, I didn't take my meds this day and this day. Well, you know, there's no way you get an accurate reading of your labs,
blood pressure
or it's
and
not
your
going to be
cholesterol.
what you want it to be. Let's put it that way. So, yeah, it's so important to manage your medication.
And if you think you're taking your meds properly, you may go in and say, well, I'm taking them every day, and maybe you're not, and you're not aware of it, and your blood pressure is high. Well, the doctor's going to be thinking they need to put you on a new prescription.
Yeah.
And so, but maybe you just need to be taking your current prescription
have.
better, more regularly, and you could avoid getting on another medication.
Yeah.
So that piece can be dangerous, and so the prescriber wants to know you're taking your meds properly. So your doctor's going to love this. If you bring one of these in, you know, we always get compliments on it that, you know, oh, I'm so glad you're doing this, you know, and we actually put a medication record med list in each pack, so the patient can take that and show it to their doctor, and it shows you exactly what meds are in the pack, how to take them, how many are in there, the prescriber, and so forth. So it's very organized and streamlined. So I encourage you to consider, if you're a caretaker or a patient that needs this, call us. It's just a way to simplify your life. You're not giving up your independence. You're able to shift your independence to things that are more enjoyable,
Yes.
besides the medication burden.
Exactly.
So, you know, that's the important piece. You can focus on doing what you enjoy doing and focus on your health. And, you know, nobody wants to spend time filling up a pill box. I've never
Exactly.
met somebody that enjoys doing that.
No, absolutely not. So this is a great way to, and you can give your number again.
Yeah, so you can call us
them.
at 252-443-7979. That's 443-7979. If you hadn't heard of our pharmacy, it's Medical Park Pharmacy in the Medical Park building over on Winstead Avenue, the big 5-story building, often referred to as the Boyce Willis Clinic. It's right there, you know, across from the Harley-Davidson shop, and near the El Tapatio and so forth. Right there on the first floor, you go into the right, and we serve the whole Rocky Mount area, not just the folks in that building. You don't have to
That's right.
see a doctor in that building or anything like that. We're open to everyone in the community, always taking new patients. So we'd love to help you. We can even do a home visit. So if we have our technicians go out into the home and go through the meds if you're homebound. So that's a free service as well.
Very good.
So.
Well, we appreciate this information. Again, Thomas, always a pleasure. The first and third week of the month, we enjoy the information that we get. So, because I hear that from our viewers.
I'm glad to hear that. We enjoy doing it.
And we'll see you back in a couple of weeks.
All righty. Thanks,
All
Sandra.
right. We'll be right back with some weather.